Rajendra Institute of Medical Sciences stand here in front of you to present my scientific paper entitled Harmonizing Motherhood, a narrative review on the impact of music therapy on maternal and neonatal well-being. We all know that pregnancy is a joyous period, but still pregnancy-related physiological and psychological changes increase and risk anxiety, stress, and depression, which can adversely affect the maternal health, fetal development, and neonatal outcomes. Prenatal musical therapy is a safe, cost-effective, non-pharmacological intervention shown to reduce maternal stress, anxiety, and while promoting fetal development and neonatal well-being. However, further evidence is needed to understand this phenomena better, further leading to a question that whether what are the effects of prenatal music therapy on maternal mental health, fetal cognitive development, and neonatal outcomes during pregnancy. Justifying the significance, this review highlights music therapy as a safe, cost-effective, and non-pharmacological intervention for improving maternal mental health, neonatal well-being. By synthesizing current evidence, it supports the integration of prenatal musical therapy into routine maternity care and identifies future research priorities to strengthen evidence-based clinical practices. The objectives of this review were to explore the extent and nature of research and prenatal music therapy, to examine the reported benefits of music therapy and its exposure on maternal and neonatal health, to identify the gaps in the literature of future research directions. The methodology used was the PRISMA flowchart, through which total 112 studies were selected from various databases such as PubMed, Scopus, and Web of Sciences, from which 22 duplicate studies were excluded, and leading to 90 studies, from which 70 were again excluded for the from which only title and abstract were taken, and 20 were found. From those 20, the studies which did not meet the inclusion criteria, such as which were not related to prenatal musical therapy or did not provide empirical evidence, all conference abstracts or editorials and non-English publications were removed, finally leading to 8 studies which were included in this review. These studies were finally charted under the following categories: author, research, design, objective, sample and sample size, outcome measures, and the findings. All the 8 studies. Finally, giving the results that in all the 8 studies, among all the 8 studies, there were RCTs, systematic reviews, longitudinal studies, qualitative and experimental design studies. Prenatal music therapy consistently reduced maternal anxiety, stress, and depressive symptoms, improved the neonatal outcomes which were reported, such as including fetal learning, orientation responses, auditory memory, and physiological stability. Overall, music therapy emerged as a safe, low cost, and feasible complementary intervention during pregnancy. Coming to discussions, the reviewed evidence consistently supported the beneficial effects of prenatal music therapy on maternal and neonatal health. Music therapy promotes relaxation, reducing maternal psychological distress, and enhancing emotional well-being. Positive fetal and neonatal outcomes indicate potential benefits for early neuro development and maternal infant bonding. Though there were variability in study designs, intervention protocols, and outcome measures, these limited the direct comparison and standardization. Therefore, leading to future researches which would establish standardized protocols and evaluate long-term maternal and neonatal outcomes. Still, even though the study has shown consistent results towards the benefiting effects of music therapy, there were certain limitations, such as the variability in study designs, methodologies, limited the ability to draw standardized conclusion. Most studies focus on short-term benefits with limited research on long-term development impacts of the newborns and their future life. Therefore, standardized protocols for music therapy interventions also need to be developed. From this review, we can do further research after this review, such as establish standardized methodologies for prenatal music therapy interventions, assess long-term cognitive and emotional effects of prenatal music exposure, investigate the influence of music type, duration, and frequency on maternal and neonatal outcomes, and explore the potential of integrating music therapy into standardized prenatal healthcare programs. The implications of this review:
चली
it
गई
can be
पीछे.
integrated in the routine antenatal care as it is safe, non-invasive, and cost-effective complementary intervention. It can promote maternal psychological well-being by reducing the anxiety, stress, depressive symptoms, and liver-related discomfort. Support support fetal neurodevelopment and neonatal outcomes, and it also empowers nurses and midwives, and it can also develop standardized clinical protocols. The take-home message is Harnessing the therapeutic potential of music during pregnancy may contribute to improved maternal mental health and healthier neonatal outcomes, supporting a more holistic approach to maternity care. Thank you.
Yeah, why didn't you present your forest plots? Because the issue is about the heterogeneity, which you have yourself highlighted that there will be heterogeneity because of the duration, the type of study. Some are themselves RCTs, while some are cohort studies. So that would be the issue, and definitely there is. So the heterogeneity issue will come up. So and the risk of bias. So the heterogeneity studies and the risk bias are not present here. So what is your take on that?
So it should have been included. Box plots and forest plots which would have shown that how much deviation in the studies are there. It was a mistake that I would do it, so I said mistake. I will further include it wherever.
My question is, if there is heterogeneity, what do you do?
So if there is heterogeneity, we can, since only eight, actually the limited studies were there, sir, which could meet the inclusion criteria. But if this could be done in a systematic review further, it is just a narrative review, sir. If systematic review could be done, then that heterogeneity problem could be solved.
Okay. Thank you.
Thank you, sir.
Now we are having the next presenter, Ms. Mamata Tobo, Associate Professor, College of Nursing, Rims RANCHI.
So a very good morning to each and everyone. The study began not in the laboratory, but in a quiet afternoon, where conversation with my student who came up with a problem which she was facing, what to feed uh, her mother, how and what to feed her mother during chemotherapy. So, so my study is to assess the nutritional status and knowledge and practices among the patients, cancer patients receiving chemotherapy. It's a descriptive study. Cancer, as we all know, is a major global burden, and approximately near about 19.9 million new cases are coming up every day. And in Jharkhand, if we see that the new cases reported is 35,000 to 40,000 cases per year it is coming up. And there is 70 cases per 1 lakh population. And the leading cancer in Jharkhand is in the male is oral cancer, lung cancer, and stomach cancer. And in the female, it's breast cancer, cervical cancer. And through our study, I wanted to bridge that gap which is coming up among the patients regarding the knowledge of cancer. The statement of the problem is a study to assess the nutritional status, knowledge and practice regarding nutrition among cancer patients regarding chemotherapy with a view to develop nutritional booklet in selected hospitals in Ranchi, Jharkhand. The objective of my study was to assess the nutritional status of the patient and to explore the knowledge and the practice regarding nutrition among the patient and to find out the association between the selected social demographic variable and the nutritional status and to identify the association between the knowledge and the practice among regarding nutrition among the patient and last but not the least to develop the nutritional booklet for the patient. The conceptual framework which I used was Ludwig von Frederick, which it is a general system theory model in which there is an input, throughput, and output model in which the patient patient knowledge and the socio-economic demographic was the input. Throughput, we wanted to know the knowledge and the practice regarding nutrition among the patient, and the output was the nutritional booklet. As we all know, there is a major problem which the cancer patient face, are the side effects which the patient face during the chemotherapy. However, these the major side effects which the patient faces are appetite loss, nausea, vomiting, and these among these lead to the malnutrition in the patient. In Jharkhand, the socio-economic and the uh, cultural biases are one of the factors which is leading into the nutritional imbalances among the patient. And as we all know that the patients are at risk of malnutrition among when they are getting receiving chemotherapy. The study was conducted in the selected hospitals. We have taken Rims Ranchi and also Ranchi Cancer Hospital, Kake. And the total number of patients we had taken was sample was 150 cancer patients, in which we assessed the knowledge. Knowledge was calculated with the help of BMI and PG FGA, and we have also taken the practices by asking through the questionnaire. We have taken we have asked question to the patient regarding what their knowledge was regarding them. Uh, Regarding the result which came up, I just want to say a few things regarding the result which came up, that 68% of the participants were malnutrition, in which the 42% were very qualified, and there was a significant association which we found out between the lower economic group and the higher malnutrition risk, and the patient with the higher education level has the higher knowledge, and these findings highlighted the overall study about the socio-economic background and the relation with the nutritional status of the patient. And through my study, I just wanted to highlight the importance about the knowledge, and through our study, we had developed the nutritional booklet, which we had used, uh, had used for the patient, and we had tried to find out how the nutritional booklet can be done. It can be, this is the recommendation for the further study, that this nutrition booklet can be used with the patient, and during the nursing practice we can enhance the nurses with